I'm Dr. Ashish Day, and I'm a senior consultant in Department of Laparoscopic and General Surgery, Sir Gangaram Hospital. I'll very briefly tell you about what laparoscopy means. Some people come and tell me, Doctor Saab, laser से surgery करते हो क्या? Laser is a completely different thing, and laparoscopy is a different thing. Laparoscopy is when we fill up the abdomen with gas and do the surgeries with small holes, which can be 5 mm or 10 mm wide holes. So the general purview of a laparoscopic surgeon is mainly gallbladder surgeries, appendicectomies, colon surgeries, hiatal hernia surgeries, including fundoplication for GERDs. We do bariatric surgery, which means we make fat people thin by reorientation of the organs inside the abdomen. Sleeve gastrectomies and Roux-en-Y gastric bypass are the two most common surgeries that are performed by laparoscopic method. So the benefits in laparoscopic surgery would be because the holes are small, there is no big cut, the pain is less, the patient comfort is more, the incidence of a hernia occurring in the site of the surgery in future will be much reduced. The patients are able to go home earlier, they are discharged early, they resume their activities earlier. So all the benefits of laparoscopy in all the surgeries that we are able to do, we try to give the benefit of the surgery to the patient by doing those surgeries laparoscopically. Well, there are some common myths that patients ask me, like in laparoscopic gallbladder surgery, डॉक्टर साहब पत्थर तो नहीं रह जाएंगे, या लैप्रोस्कोपी से कराएंगे तो दोबारा हर्निया होने के चांसेस है क्या? See, let me make it clear. In gallbladder surgery, we remove the entire gallbladder with the stone, so there is no question of stones being left behind in the abdomen by laparoscopic surgery. It's the same surgery that we do in open, but because it's through smaller ports, it is less invasive, and therefore it is beneficial to the patient. Otherwise, the surgery remains the same. In hernia surgery, we put in a big mesh after closing the defect in the hernia. So the wide overlap of the mesh would prevent a recurrence more often than an open repair of the hernia will do. So wider the overlap, wider the coverage of the mesh on the hernial defect. So the chances of recurrence are actually less than in open repair, and there are all the advantages. The wound infection rates are less, the mesh infection rates are less. So I believe even if you do bariatric surgery, I mean doing a lap sleeve gastrectomy or a lap Roux-en-Y gastric bypass, we don't think of making a big incision and doing the same surgeries by open method. So laparoscopy will have all the advantages. So I believe being a laparoscopic surgeon, there are a lot of surgeries. I'd say around 70 to 80% of my work is laparoscopically. Of course, there are indications where we do open surgeries. Those are specific indications, and they are done only when the patient needs it or the patient is not fit for general anesthesia. So any queries or comments is most welcome. I'll put in my contact details and my email address at the end of this video. Thank you.